Mary Pepino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Every show, I try to challenge myself and come up with a new and interesting topic. And today's show is going to be about pain management. Pain is something that so many people have to live with, and you probably think that diet and exercise are truly not that important of a component to managing pain. You're going to be very surprised. I'm going to be joined by Dr. Gemma, one of my dear friends and a pain management specialist, and another dear friend, Eva Bevilaqua, to teach us how to live and manage pain more effectively. Thank you for joining us, and I hope you enjoy the show. We're very fortunate to have one of the best pain management doctors in our area. And I am truly honored to call you my dear friend and to have you with us today. Dr. Gemma, Medical Director for the Surgical Hospital at Southwoods, board certified in anesthesiology, and a specialization in acute and chronic pain management, which is what brought you here with us today.
Yeah, thank you, Mary.
Thank you so much for being here. So many people, doctor, as we have talked about in the past, live with pain, and it's so difficult and such a challenge. And you are so interesting and have, researched and can help them in so many ways that I really thought it was important that we dedicate a show to this with you. So,
well, thank you, Mary. I believe in part of my training and really all of my life, I've had the philosophy that motion is life. And when we stop moving, we stop living. And regarding anesthesia, that seems to be kind of a variant from that, but it actually is part of the whole perioperative process. We like to look at patients before surgery, during surgery, after surgery, and then the conditions that can develop from those surgeries or from prior injuries. That's where the pain management component comes into the anesthesia practice.
And you can also help people that have had no surgeries but are just living with pain.
Correct.
Let's talk a little bit about chronic and acute. What's the difference?
Well, we look at acute pain as those things that happen as a result of an expected injury or illness. If you break your arm, that pain from the broken arm is an acute pain. When we look at chronic pain, we'll take cancer pain kind of out of this picture, but the societies for pain management, American Society of Anesthesiologists, they look at chronic pain as something that continues longer than it ever should. And some people put time variables on it, whether it's 6 months or how long, but if it's your pain and it's lasting longer than it should, it becomes chronic in nature. And then we start to see all the other effects of that chronic pain on our lives. And that's where I am interested in. I like to help people deal with that pain. I like to provide them with knowledge, with information, as well as my technical abilities, injections and things like that we do in a pain practice.
And when I think of pain, I think of a muscle or a joint pain. I think of maybe a stomach ache, a migraine. But you brought out some interesting things when we were preparing, like you say, a cancer pain.
Sure.
You were talking about different head and brain type of pains, things with the digestive system. I mean,
visceral pains. We call those visceral pains, pains coming from organ tissues. And people with irritable bowel, with Crohn's, with ulcerative colitis, with pancreatitis, with liver infections, all of those can lead to their own pain patterns. Lung injuries, lung illnesses. We talked about migraines and different brain disorders. They all manifest themselves in different ways. One of the things I find interesting in my acute pain setting, somebody comes for a gallbladder surgery and we're doing it through the laparoscope. They'll wake up and say, boy, my right shoulder really hurts me. And they don't understand what did we do with their shoulder during surgery that causes the pain for the next 24 to 72 hours after the case. It doesn't come from that at all. It actually comes from the diaphragm muscle that separates our abdomen from our lungs. That diaphragm muscle gets irritated in the laparoscopic process and it refers pain to the shoulder.
Now, when you say the laparoscopic process, just for our viewers that may not know what that is.
That's where we put air into the abdomen, and we use very small incisions and tiny instruments in order to do gallbladder surgeries, colon surgeries, a variety of things within the abdominal cavity where they put carbon dioxide, something we normally breathe out. We put that in the abdomen so that we can better visualize all those structures.
And that reduces the amount of cutting that you have to do, correct?
The incisions are smaller. The idea is that when we disrupt the abdomen to greater degrees, then that leads to more splinting of the abdomen and longer healing times of those tissues.
What makes a quality pain management practice?
Well, that's what I strive for. I think it's very important to be encompassing. If you're a hammer and everything looks like a nail, that's not a quality practice to me. Because I do injections, I try not to limit myself to that just being what I offer patients. I try to offer other arms, and with Eve coming to us later in the program, I think that's a very important arm, showing motion, showing how to reinstill that motion to some people that are in chronic pain that have basically lost their motion. I think medications, using non-narcotic, narcotic, but mostly other modalities, what we call multimodal pain management, meaning we use therapies, whether they be physical, psychological or emotional support, aquatic therapies, looking at diet, lifestyle, alcohol use, smoking. You have to encompass the patient's whole life. I can't just go in and say, you're an epidural steroid or you're a facet injection. That to me is not being a physician.
Now, could you be the manager of this team or the quarterback of this team, as I'm going to call it? So I have pain, I'm going to call my primary care physician or you. Then can you manage it so maybe I need a little more medication starting out and to wean myself off of, and we're going to incorporate, let's talk a little bit, maybe we incorporate a dietitian, correct?
Absolutely.
Exercise physiologist or physical therapist.
Correct.
You want to incorporate your family physician along
Absolutely.
with, you as the specialist. When you get into things like, I think outside the box about acupuncture, I think of massage, things like that. Yes, no?
Well,
chiropractors.
I'm a big proponent of all of those modalities because I think that we are individuals. There isn't a prescription that takes care of all lumbar pain. Everybody has to be looked at individually. Better evaluate what fits best in your life. I believe in all of those things. And the thing that I think we're very blessed with in this area is we have some very good people in every one of those modalities. I feel like we have a very good core of referring physicians, referring allied health professionals in our area that I can go to for help and give that patient that guidance to go and see the aquatic therapy, to go and see the chiropractor in the area, to go and see a dietitian that can help them maybe better align their lives and their dietary intake to help in their pain and help in their lifestyle.
And let's talk, in my little world, we'll talk a little bit about diet and exercise. And we were talking about some examples again in preparation. Protein is very important to this. And people don't realize, especially women, how sometimes they don't get enough protein in their diet. And I think the mindset is it's always about weight, losing weight or being thin as opposed to being fit and healthy.
Right.
So talk to us a little bit about what kind of foods you like incorporated into the diet.
As I like to do in all patients that I see preoperatively, in part of my anesthesia hat that I wear, when I'll see somebody in pre-admission testing, I try to stress dietary importance. And I use the analogy of tuning the car for the trip to Florida. You're not going to go if there's no oil. You're not going to go if your antifreeze is empty. You want to prepare your body for the time of surgery like you were taking that car on that trip. So I think it's very important that people realize that. An interesting story I think I shared with you yesterday, and patient coming for an abdominal surgery that didn't tell anyone that a diet of brown rice for 3 weeks prior to the surgery was what she was prescribing because she was trying to lose as much weight as she could. Not knowing that it depleted her protein source and her essential chemicals within the body to create blood clot. So we had issues with her continuously bleeding until we replaced those factors. So we actually had to transfuse in order to cause her to clot again. And those things people don't appreciate. So I try to emphasize a good diet, protein sources, because those proteins are those building blocks that we need to heal and to create non-scarred type areas.
And I always tell people, in my world, any diet that excludes a food group, good fats, good carbohydrates, which includes, fruits, vegetables, starches, good protein, you need it all. So you don't want to exclude, and water. You shouldn't be excluding any one of those four major, macronutrients. And protein you can get. It doesn't have to be red meat, or it doesn't have to be chicken. You can get it from lentils. You can get some from dairy. I mean, there again, Google, you can get so many sources.
And I think a big challenge is in the time of surgery where you are under a stress. We have to face it, that any time you're going for a surgical procedure, that puts another stress on your body. So then telling people at that 11th hour or in the 3 weeks prior to change their lifestyle that may have been the previous 70 years is a very hard thing. But we try to evaluate them and see what can you add in this time period that is the best help for you.
That's so important. I want to talk a little bit too about smoking, because I know people don't realize, it's not just bad for you, overall. I mean, when you're talking about having a procedure or trying to heal from a procedure, it definitely negatively impacts, correct?
Yeah, absolutely. And there's a point in time I could probably cite 90% of my patients that come to see me after previous back surgery that continue to have back pain, especially those that have special screws or rods put in to help stabilize the spine. The ones that are smokers, they seem to be the ones that come to me for boy, I'm just not healing right. And when we look at it, and there's a lot of studies in orthopedic and spine literature that show micronutrients are not delivered because smoking causes a squeezing down of those blood vessels that normally deliver those nutrients to the tissues that are trying to heal. So you end up with scar formation, you end up with things that don't bond and heal the way they should because of being a smoker, despite the things that we know about lung cancer and chronic smoking.
Some tips, avoid alcohol.
Absolutely.
Why?
Biggest part about alcohol is one glass of wine may allow you to sleep a little bit or fall asleep a little easier. But larger amounts of alcohol use actually disrupt what we call the good sleep, or the REM, the REM sleep. Altering that, you get up in the morning, you're not refreshed. You didn't get the substantial level of good deep sleep that you needed. And alcohol is a contributor to that, despite the caloric and other effects of alcohol on liver function and brain function.
Now, I'm having trouble falling asleep. I'm in chronic pain. We're having starting to manage this process, and I've just found you, or I haven't found you yet. So maybe I'm drinking some alcohol thinking that it's going to calm me down, or, I can't go to sleep because of this. What can you do to help me to sleep better as we're starting to work through this pain management?
Well, I think, and we'll speak of this in a little bit, especially when we touch on Eve's segment, is that there are ways that we can relax that are non-medication, non-alcohol ridden, non-drug senses. Relaxation techniques, very important. The dangers, and especially those people that are on narcotic type medicines and mixing alcohol with those, they can have some very strong repercussions regarding falling too deeply to sleep. And an actual position paper came out in the last 6 months from the Joint Commission on overdosage of narcotics in patients, and those things can contribute to the hazards of those medicines, those things like alcohol.
And it's interesting because the things that some people are doing that they think is helping to mitigate their pain is really making it worse in the long run. That little short-term fix is just maybe taking them, away from it for a few moments, but it's really making it much worse in the big picture.
It's duct tape on the dam.
Yeah.
It's not fixing the dam.
Eve we're going to talk a little bit about yoga and meditation, but I know you have a very interesting story about Tai Chi.
Absolutely.
And there are, for our viewers, there are people in this area that do have some great Tai Chi classes, but tell us what they were finding with Tai Chi.
Well, the interesting thing that came out of a study with 14,000 patients, and that's a substantial number. That's not just 50 people randomly selected off the street. But a university in California took a look at the study and put 14,000 patients, segregated them into those that had Tai Chi and those that just continued on their routine medications. They found in the Tai Chi group, those that had the arthritis, this was basically an arthritis group that they were looking at, they decreased the amount of pain medicine they required. They increased their functional mobility. They felt better about themselves. It was a very strong study, and I think those things like Tai Chi, which is a non-impact, stretching, relaxation type of exercise, helps stabilize our body. And I think stability is the most important thing. I have so many patients of mine who come in and say, I have back pain, but I've been doing all these abdominal crunches to help it. If you don't do anything to help the extensor muscles in the back, you're really not helping your back pain. You may actually be making it worse. So doing things properly and providing a support to the column, I think that's very important, whether it's a knee joint, an elbow joint, a wrist joint. You have to look at the joint encompassing, not just as one side. If the front side hurts, it doesn't mean the back side doesn't need to have some attention to it.
And you know, a little tip to viewers, Google Tai Chi. There were a couple of very interesting videos, and people, you know, often think about it more like a karate, and it's not. It's very slow and controlled, and you know, just about anybody can do it and get started with it. So strongly recommend you at least look at it. Another key point, keep a journal, you recommend.
Absolutely.
Why, how, what? And I'm a big journal person, but I never thought about it for pain.
Well, I think it's important. We do it for diet. We do it for just thoughts that we have through our lives. But in pain, it helps when you come and see me, or you come and see whatever arm of pain management that you're in, and you can reflect, well, this was a really good day, and you can look back and see what caused that really good day. And the adverse is also true. This was a really bad day. What caused that really bad day? And I think that helps us as health professionals identify the triggers for the good days and for the bad days. And sometimes you need that third party to look at those things and say, these type of activities lead you to this. You need to avoid this. So it's a nice reflection on your recent past and the things that make you better and the things that make you worse.
Very important point, a tip. Understand your medications.
Absolutely. I think we got ourselves in problems in this country and in this world with antibiotic usage because everybody that went to the doctor wanted to get something for their visit. So I have a sore throat, I need an antibiotic. I have an ear infection, I need an antibiotic. They associate a pill with a cure. Not necessarily true. We now know that all those scripts that we provided over the course of years have created huge resistance in antibiotics. So it's real important that we understand why we're taking the medicine and what we're taking it for. Sometimes there are certain medicines that may help us sleep a little bit better that are non-narcotic. Well, then let's tailor those to the patient after they eat dinner, especially in the elderly. Let's use those to help them get a good sleep cycle in. If they don't affect sleep, use them for what they're for. You may not want to use it at 10 o'clock in the morning because it may alter your day and make you not want to get off that couch all day.
Physicians' times are so limited today. Unfortunately, you're in such demand. And I know it's important, some people are intimidated to ask their doctor a lot of questions about the medications. And the other thing is they'll go online and look them up, and then they'll find 100 things that maybe they have, you know, a zillionth of a chance of happening, and they panic and think, is it doing this to me? So what's your advice on how to understand your medications?
One of the things that we do in our practice, any prescription I write, the patient gets a whole publication of what that medicine does, what the side effects are. They can read it. If they have questions, they ask me about it. I will tell them before I give them a medicine, you may experience X, Y, and Z with this. That may be normal, that may be abnormal. If it's abnormal, please call me or stop taking the medicine and call me. There are programs that you can get from either your doctor's office or any hospitals. Hospitals actually are mandated. If we give you a new prescription, we have to tell you what that drug is for, and we have to give you a little bit of a brief summary of its actions.
Do you agree that it's important for patients to always tell their doctor as well, the treating physician, if you're taking any supplements, just because they're over the counter and they're called a vitamin, or they're called a health supplement, or a cold tablet, or if you have a little diarrhea and are taking Imodium. Just because it's not a prescription, you need to know what it is, correct?
Absolutely. In the vitamin supplement world, you're looking at billions of dollars in the industry with no governance. The FDA does not oversee the production of those things. Some people may think they're taking a cholesterol medicine because they're afraid of Crestor or Lipitor, one of those other drugs, and what it might do to their liver or muscles, not knowing their vitamin supplement performs exactly the same way, and they should have their liver functions monitored if they're on the supplement. But nobody at the supplement store is going to tell them, now make sure you go and get your liver function tested. Those are very important. Prior to surgery, we have a whole list of medications, and if you come to the surgical hospital at Southwoods, we review those prior to you coming to surgery. We review your medicines over the phone. We like to see if you're on certain supplements, we'll ask you to discontinue those because they cause bleeding risk. That's the biggest one that we see. Patients on ginkgo, garlic, very common, but they also can affect your bleeding risk, and we don't want that around the time of surgery.
Reach out for help. Share feelings with friends and family to help better understand your actions.
I think that's very important because sometimes the depression of pain isolates a patient, and I see that very frequently. They alienate their family, they alienate their friends because they don't feel like they can appropriately interact. They feel a sense of shame or embarrassment. They feel like they're not the person they used to be. And I encourage them to try to reach out and have that discussion of, boy, I really feel bad, but this is why I feel bad. And I think that's very important. At least it shows to those around you that you've acknowledged that there is a change and look for their assistance in helping you improve.
I think your advice is so important to so many people, and I'm assuming no matter what your chronic pain is, at least you can call and find out if there's something that can be done for it, correct?
Absolutely.
No question is too stupid or too bad.
Never.
If they want to reach your office, we can call the Surgical Hospital at Southwoods,
330-729-8000.
And we ask for the pain management unit.
Yes.
And can they have a consultation with you?
Absolutely. We will schedule consultations. Myself, Dr. Corfius, Dr. Allen, all provide pain management services. We have our entire army of support staff that are excellent in the philosophy of treating patients as they would treat their family, as they would treat a dear friend.
And you work very closely with the primary care doctors as well, right?
Absolutely. I don't do anything without them because I encourage this to be a team approach, and I don't ever want anybody to feel like I want to take that patient and make them mine. I want to offer my services to help you help your patient.
It's a team approach.
Absolutely.
I want to get with Eve and we can demo some of the things. I cannot thank you enough for being with us. A very interesting and enjoyable topic, and you've helped so many people, and I have a feeling you're going to help a whole lot more after this show airs.
Well, we try, and thank you very much for having me. It's my pleasure.
Thanks, Dr. T. You've had the pleasure of meeting Dr. Gemma. And now I'd like to introduce you to, and you may have seen her on a few of my other shows, somebody who I can tell you I truly admire and is probably one of the very best in the fitness industry, my dear friend Eva Bevilaqua.
That's because I've been in it so long.
And there are a few people I truly look up to and admire.
Oh,
you're the person I want to be.
Thank you.
Thank you for being with us. You are the expert, much more so than I am, especially at yoga, a little bit, with the Tai Chi moves. And as we were talking with Dr. Gemma, exercises that involve mindfulness, yes, slow and controlled. And Dr. Gemma, Eve is going to demonstrate some of those. I'm going to let you two chat a little bit about it now and demo what we can be doing for pain.
Sure. As Eve and I talked before about how important the core stabilization is. And some of the techniques that you have are instrumental in establishing that core stability.
And very simple too, Doc. Very, very simple. Now the core starts right here above your knees and goes right to the top of the rib cage, front and back, of course, and sides. Now if the core, we can compare the core to a retaining wall in your commercial building or in your home. If the retaining wall is weak, the building falls down.
And you know, you're making a great point. People think of their core as just their abdominal area.
No, it's
so you
got
to take those legs.
It includes the glutes. Yes, it includes the back, all the way around the body. So this is very important. If this is unstable, you're going to have pain in your shoulders, in your elbows, in your wrists, in your knees. All your joints are not going to be stable because the core is not stable. One of the simplest ways to get the core in shape is a stability ball. And it's got a proper name, doesn't it?
Yeah.
Stability. So if you want to, and you're a beginner, all you have to do is get a hold of this stability ball and sit down. By just sitting down on the stability ball, your back is going to go into a neutral position, already strengthening it. So here you are, folks. While you're sitting watching television, get on your stability ball. Sitting behind your computer, sit on your stability ball. Put your hands right here on your thighs and bounce up and down a little bit. You can feel the muscles in your thighs working. The good thing about this stability ball, Mary, is not only am I working my quadriceps, if I put my hands underneath here, I'm working the backs of my legs as well.
And so, you know, I'm a big fan of the ball.
Oh, I love the ball. I love the ball.
And I think the other part that's important is, without realizing, those erector muscles of the spine are also coming into play.
Absolutely.
By maintaining the posture that you're in.
Absolutely. And your abdomen. You're automatically holding your abs in when you're on here. So all you do is have a seat. Slide side to side. Slide forward and back. Do a couple of nice little easy stretches. It's such a simple thing to do. Once you feel more stable on here. Now
let me ask Dr. T,
sure.
if you cannot sit up on, because to some people this is not an easy move.
Yeah.
Can you give us a little bit of, how should we get started if you can't get all the way up, if you can sit straight?
And Eve can correct me if I'm wrong, but the size variability of these balls, I think, comes into play. For those that can't get to those positions, there's bigger balls, there's smaller balls. So as you progress in your development of this, you can change sizes of the ball to fit your abilities.
And as you bring up the size, Eve, why don't you comment, we like a ball, and you can comment where you're at a nice angle with the knees. You want to explain?
The knees and the hips should be in a pretty straight line. If the buttocks is lower than the hips, it's all right, but if the buttocks is lower than the hips, you're going to be working a lot harder. So for a beginner, you want to make sure that the knees and the hips, just like mine are right here, my knees and my hips are in a nice straight line. The wider apart your legs are, the more balanced stability you're going to have. So a lot of people are going to get on this ball. Always remember to get on the ball this way. When I teach ball, a lot of people want to do this to get on the ball. Come around the front and have a seat on the ball. By the way, it'll hold about 300 pounds, so don't be afraid of it. You know, you can get on it.
Most of us can fit on the couch.
Yes.
And that's about couch height, and I think that puts us all in about the same plane. So I think that's a great example of somebody that's just starting out in this technique to be able to develop that postural core strength that is so necessary.
That's right. We can also sit that ball up against the wall.
Right.
You know, in case you're afraid of it.
And I was going to say, or get someone like what I call a spotter in, you know, fitness.
That's right. That's a good idea,
you know, if you can't balance it right away, or you start to move and you're a little bit uncomfortable, get someone to spot you, or put something on either side so you can kind of grab your balance and hold on to, you know, until you can build up the strength to do this.
Yes, or you could even put your feet on the wall and have the ball next to the wall and have your feet on the wall in the front here. So that if you feel like you're going to fall, you'll have your hands right here. There's so many ways to do it. Don't give me excuses. Get on the ball.
And you can Google ball. I always tell people, if you're not sure, well, I don't know what to do. Google's wonderful.
Maybe you can show us, because when I see patients with back pain, the majority of them, when you look at their hamstrings, so tight. They're so inflexible. Maybe you can allude to some of the things that they can do from this position that can help those hamstrings in the stretch.
Well, let's show them what a hamstring is real quick.
It's just the hamstring's the back of your legs,
back of the thigh.
And if you have sciatic problems, it may be because that hamstring's very tight or inflamed. That's how we get those problems. They come from the spine, of course, but also from hamstrings. Just pull your toe toward you. You could do this sitting on the couch. Extend the leg. Pull the toe toward you. Of course, it's even better as you advance, lifting the leg and standing on one leg and pulling that toe toward you to stretch the hamstring. When you lean forward, instead of falling forward like this, keep your chest up and lean from here as if you're going to put your chin on your big toe. You're going to feel a lot better stretch in the back of the leg when you stretch those hamstrings. And that is an important thing for pain as well. Also on this, you can take a little walk out, lean back, and you can see I'm really concentrating now on my abdominals and pulling up, just coming up. There's plenty ways you can do. This is a short lever, a medium lever, a long lever.
And I think what's important here to note too is that you're letting your core pull you up,
yes.
not your neck and your head,
yeah.
not your arms.
Nose is on the ceiling.
Yeah, so you should almost be stable from the head to the shoulder and let the core area do the work.
Yes, now that's a little more advanced move, but just sitting on this ball is going to help.
Absolutely.
It's going to help.
The thing I love most about the pain management type of exercises are the things we want to focus on that bring us into a very mindful state of mind, focus on the breathing, focus on posture. But let's talk a little bit about mindfulness, because I know, Dr. T, as we were talking yesterday, and Eve, exercises that make us focus on mindfulness. Tell us a little bit about mindfulness and what it is.
Well, I think the important part about mindfulness is that we develop that time to find our bodies, to be able to relax, to reduce those stresses that are only contributors to our chronic pain, or even to our acute pain for that matter. Things like yoga, they're commonly used in especially beginning mindful training, where it's a time where you have to yourself, where there is no other external stimuli for you, and it's your time. So people that have the mind that races all the time, yoga is a great opportunity to develop that meditation process and to be able to find yourself considered of yourself only, not thinking about your surroundings, not listening to the TV, answering the phones, answering the next kid's question. So I think the yoga component does two things for you. It gives you the opportunity to develop that meditation mind, and it also gives you the ability to develop the stretches that you need to improve your pain cycles.
And the breathing, I'm going to step aside while you demonstrate and Doctor talks a little bit, but talk about the breathing, because that's the first step to get you, I think, into that mindful state.
Yes. Now the breath can be used for yoga, tai chi, and meditation. If you learn how to do the breath, then you'll be able to meditate, you'll be able to relax. I use the breath for hypnosis. I use the breath for my own self-hypnosis, for my own meditation. I've learned the breath, and I do it all the time.
By the way, Eva is certified in hypnosis as well. So
if you have COPD, you're probably very familiar with the breath. I'd like you, for a beginner, to take one hand and place it right here on your chest, and your other hand right here on your belly button. Okay, now when we inhale for a count of 4, we're going to feel the breath into the belly. Now don't force the belly, just let the breath happen naturally. We're going to hold it for about a 4 count, and then we're going to exhale slowly for about an 8 count. Okay, let's all try that together. Inhale first into the belly, hold the breath, and now exhale, preferably through the nose. Relax, and then try it again. Now, while you're doing this breath, you can be imagining a word that will take you. In yoga, we say Om. It sounds like home, only without the H. Om. And that kind of just clears your mind. You know, meditation's not a tough thing to do. All it means is clear your mind. Get rid of everything in your mind. And that's a tough thing to do, because the mind is like a 3-year-old. It wants to run out and play all the time. So let the thoughts come into your mind, and then just allow them to go away. Recognize them, and then let them go away. And keep breathing until your mind feels nice and clear. You might even get into the alpha beginning stages of sleep when you're doing meditation. And we do the same thing with yoga. Now you'll see people come into yoga stance, just like this. This is called namaste, and namaste just means peace. Isn't that a nice word? And that may be your word that you could use, peace, while you're breathing, to let yourself relax. Inhale through your nose. Hold that breath as you lean slightly back. At first, it's just going to be a little bit back. And then we're going to airplane down. Now, if you're new at this, with soft knees, please. Knees are soft. Come down. Inhale back up again. Namaste. Good. Doing 5 or 10 of those every morning just to wake you up will begin your sun salutations and help you to begin learning how to breathe and learning how to stretch. Doesn't that feel so good when you do that? Now, if you want to advance, I'm doing sun salutations. Namaste. Inhale. Airplane down. Touch your toes. Extend one leg and then the other. Hold it here. Knees, sit back. Nice and simple. Stretching. You can see what I'm doing. I'm stretching my spine. Now come forward and just raise your head. Now you can see what I'm doing with my back, Doc.
Yep.
This is a great thing for the back, but it's a little more advanced for some folks. Coming back, bringing a leg up front. I grab hold of it, bringing it right between my hands. Bring feet together, and we're right back to where we began before. Nice and simple.
And if you've got some pain, Dr. Tom, is working, can you work toward, like, how much pain do we tolerate when we're doing the exercise before we're like, okay, stop and let it?
Oh, no, Mare. If you feel pain, you stop.
I think the idea is that the pain kind of inhibits that relaxation.
Yes.
So the most important part, and I try to tell people this all the time, is don't be judgmental.
Yeah.
Don't judge yourself
that's
as
good.
being a failure. This is a work. And maybe the first week you don't really appreciate a difference. This is something that has to go on.
You might only be able to do this.
Exactly.
And breathe.
I have patients that can't get their hands above their head.
That's right.
But it's a work at how much can I do? And the good thing about this, I think, is in a non-straining matter, we can evaluate how we're doing.
Yeah.
And every day we start to see the progression towards, boy, I really couldn't get my hand there before, but now I can. Boy, I really couldn't get any extension into my back, but now I can. And the whole idea behind this is as we reduce those stresses, as we reduce the muscle stress, we improve blood flow. We improve those mediators that are taken by our body to fight the inflammation, the chronic problems that we're having, and try to make healthier tissues.
Yes. And just like you said, Mary, you could get on Google and you could find so many things with yoga. You can find yourself a very simple beginner's tape that can help you, and you can pop it into the CD or into your DVD at home and do a little bit of very simple yoga. There's also all kinds of beginner type yogas. You don't have to just jump into one of the really advanced yoga classes. Going slowly to get that body used to moving a little bit. And sometimes it'll help right away. You're going to notice a difference right away.
And there are great DVDs out there
Yes.
that you can, that you can get, and like you say, ease into a movement. Just because you can't do it starting out, don't consider it to be a failure.
Right.
Gradually build, and you'd be amazed at how you progress.
Be kind to yourself.
Yes.
If you're in pain, you don't want to do anything to hurt yourself even more.
And sometimes it's so hard to take that focus away from that pain.
Yes, it is.
It's work to get to the point where you
know
can
that.
relax for
Sure.
a minute. Some people can do this seconds at a time, and it takes a long time to work to it.
Yeah.
The good part about it is it's non-medication induced.
That's right.
You're not having to leave the comforts of your home. You can do this in a commercial break if you can get away from the TV. And
you know what? You could do it on the couch.
Well,
you can do it
you
in
can do it
bed
on the
even.
couch.
You could even do it in bed. Some
Yeah.
stretches in bed.
And frequently, I tell that to patients all the time. Before you get out of your room in the morning, you need to do this.
Yes.
You need to do something for yourself the minute your feet hit the floor. How many of my patients tell me the worst thing I have is getting out of bed in the morning?
Yes.
I think this is a great opportunity to get that blood flow, to get that stretch, and decrease themselves in their pain value so that the first thing they do is not have to run down and get a cup of coffee and a pain pill.
Yeah.
That's the
right.
key.
And the breathing in bed when you first get up, if you are uncomfortable, and start that breath, clear that mind, take a couple of minutes before you get out of bed, get prepared, and then get out of bed.
Yes.
And it can really make
One
a
of the
difference.
simplest things I think to do is when you wake up in the morning is to roll over to your stomach for just a couple of minutes, and if you can, just push up a little bit. That starts to stretch that back a little bit.
Sure.
Get yourself moving.
Well, give us your morning. I love her little tip on the morning cold water thing. Do you want to give us your little tip?
Well, that was for diabetics, or ice water first thing in the morning.
And
Very
I'm a
cold
water person first thing in the morning.
That's
That's the
cold
first
water
thing
first thing in the morning. It helps to burn more calories, and you want actually 2 glasses of water in the morning because you want to get those organs started and you start moving around.
Yeah, I don't let myself have my coffee until I've had my glass of
Glass
water
of
with
cold
lemon
water.
in it.
That's right. Yeah, that's a good idea.
That would be
Yeah.
a work in progress for me.
That's because you're poor thing. You're in the hospital so early. But
yes, yeah.
Eve, thank you so much for joining us. It was wonderful.
Thank you.
Dr. Gemma, we can't thank you enough. Like I said, I love you both. And to our viewers, as always, we thank you so much for watching. I hope you enjoyed today's show. Please email us, info@thefitnest.com. And if you have any questions for Dr. Gemma or for Eve, I will see that they get them. I look forward to seeing you on our next show. I'm Mary Pepino, and thanks for watching Fit for You.